I'm Dr. Jennifer Popovsky. Now that your surgery is completed, we're going to review some post-operative instructions. I'm going to turn you over to one of the nurses who's going to go over things for you. Hopefully this will make your week after surgery a little easier.
Hi, I'm Sarah and I'm going to go over your wound care instructions with you. So your wound has been left to heal by itself, and these are the supplies that you're going to use. We have a non-stick pad, some Vaseline Q-tips, some tape, and a pair of scissors. You want to take the non-stick pad and cut a patch out of it that's going to be just big enough to cover your wound. The point of the patch is just to keep the wound greasy so that it doesn't dry out and create a scab. That's what we don't want. So we're going to put the Vaseline on the patch, and then we take a piece of tape, just enough to cover the patch. And now we're going to show you how to put this over top of your wound. So you're going to take the patch that has the Vaseline on it, and you're going to place it over top of the wound. And it's going to stay there because the Vaseline will hold it in place. And then you want to take a piece of tape to secure it. Now this wound you want to wash once a day. In the shower is fine. Soap and water can run right over it. Just don't let the shower pound on it. And if this bandage comes off anytime during the day, you just want to apply a new one. Here's some additional instructions for you for the next week. You want to leave that pressure bandage on for at least 24 to 48 hours. And make sure you wash your hands before doing any wound care. It's the best way to prevent an infection. Also, if we have given you a prescription, make sure that you take it in its entirety. You want to take it easy for the next 3 to 4 days. No alcohol, exercise, or anything that's going to get your heart rate or your blood pressure up. The doctor might have instructed you to take it easy for the entire week. If that's what she has said, then make sure you follow her instructions. You don't want to take any aspirin or ibuprofen products for the next 3 days. We may have given you a prescription for a pain medication, and you can take that or Tylenol if you're having pain. Also, your bruising and swelling may increase for the next 2 to 3 days. After that, everything should start to improve. If you have to bend over to pick anything up, make sure you bend at your knees and not at your waist. We don't want you to swing your head down and increase the pressure underneath any bandages that you have. If you're having any problems or concerns, feel free to call the office. We'll be happy to help you.
I hope these instructions have been helpful for you. Please know that if you have any questions, concerns, or problems, that you can call the office at any time.